Assalamualaikum warahmatullahi wabarakatuh. My name is Zulhaimi bin Musa. My student ID is 2020265106 and I am from NHS P8B. Today I'm going to present about the impairment of vision and hearing among the elderly. The definition of visual impairment is a low vision is defined as central visual acuity of 20/70 or worse, the better seeing eye with the best correction, or a total visual field loss of 140 degree. Legal blindness is defined as central visual acuity of 20/200 or worse in the better seeing eye with the best correction or a visual field of 20 degree or less. So person with a legal blindness may have an adequate vision to maintain the activity of daily living and function independently. Meanwhile, hearing loss is a reduced ability to hear sound in the same way as other people. About 1/3 of other older adults have hearing loss, and the chance of developing hearing loss increase with age. So people with hearing loss may find it hard to have a conversation with friends and family. World Health Organization or WHO at 2010 has estimated that up to 285 million people worldwide have some form of visual impairment and 39 million are blind. So of the blind, 82% are aged between 80 years and above. So the overall prevalence of elderly individual in Malaysia, lets us narrow down, with a vision disability was like 1.8% among pre-elderly, which is age 50 to 59 years old, and 4.5% among elderly, aged between 60 years old and above. And let us narrow down again in the term of hearing impairment. So in Malaysia, the overall prevalence of hearing disability among the elderly was 6.4%, which is the prevalence was higher in the rural area, about 7.0%, and compared to the urban area, 6.2%. So in terms of sex, the prevalence was almost similar between the male and female, which is 6.3% and 6.6% respectively. So what is sign and symptom of visual impairment? There is 5 sign and symptom for those having a visual impairment. This is very common. The first one is blur vision. Number 2 is sensitivity to light. Number 3, difficulty in reading. And number 4 is eye pain. And the last but not least is limited mobility. So how about the sign and symptom of the hearing impairment? The first one is they're usually unable to understand the people talk. The second was they sometimes hard to follow conversation between the two or more people when they are talking. Okay, sometimes they also often ask people to repeat what they are saying. Okay, they also have a problem understanding speech because of their background noise, and they think that people around them are mumbling. Okay, the last one, the most common one is they can't understand what being said, and when children and people with the higher pitch voices speak. So what is the causes of the vision impairment? The first one is the most common one is glaucoma. What is glaucoma? Glaucoma usually caused by the high pressure inside the eye as a result of blockage in the eye drainage system. Okay, number 2 is diabetic retinopathy. Is a complication of diabetic that damage the blood vessel inside the retina or at the back of the eye. Okay, the next one is vision impairment or vision loss resulting from acquired brain injury, which is damage the area that control the sight and coordinating of the eye movement, such as stroke, brain tumor, head injury, and sometimes meningitis. Okay, the fourth one is retinitis pigmentosa. Is actually a name or collective name for a range of genetic hereditary disease. All right. The last but not least, optic neuritis. So it is an inflammation of the optic nerve that cause blur, gray, and dim vision. So the causes of the hearing impairment is, the first one is loud noise. Okay, noise from lawnmower, snowblower, or maybe loud music can damage the inner ear structure and result in permanent permanent hearing loss. Okay, number two is earwax or fluid build-up. So it blockage the sound traveling from eardrum to the inner ear. Okay, the third one is the ruptured eardrum. Okay, the eardrum damaged by infection or prolonged infection. Okay, and number four is hearing loss. Hearing loss due to the medication. Okay, this medication may be used to treat a serious problem like cancer or heart disease. Okay, the fourth one is genetic variation. Right, genetic variation also contribute to the causes of the hearing impairment, such as autosclerosis. Uh, The risk factor for visual impairment is the first one is presbyopia. Presbyopia is a condition which is caused by the natural cause of aging, and the cataract. Cataract also contribute to as a risk factor. Cataract occurs when the lens inside the eye become opaque, thus it block the light from focusing into the retina. All right, this will become a patient having a blur vision. Okay, the third one is glaucoma. Glaucoma occurs when the pressure inside the eyeball increase, so patient will present reduced peripheral vision. So what is risk factor of hearing impairment? The first one is noise exposure, medication, cigarette smoking, injuries to the head, infection of the ear, and last but not least is ototoxic substances. What is the burden of the aging among the elderly? Okay, this disability substantially impact the person's quality of life, independent and daily activities. Yes, of course. Sometimes the visual impairment also make reading, recognizing face, navigating difficult, lead to association, despair, and fall. So it also affect their activity daily of life, such as cooking, cleaning, and the most worst case is the it will affect the personal hygiene. Okay, number three is hearing loss also can cause a communication issue, which is social isolation and depression. So it can potentially endanger a person by blocking the vital warning. So hearing aid, magnifiers, environmental changes, and social support can ease the hardship of aging with vision and hearing impairment. So detecting and treating this deficit early will improve the quality of life. Now we are going to talk about the role of physiotherapists in visual and hearing impairment among the elderly. So the physiotherapists they can play a crucial role in enhancing the quality of life among the elderly. So they can collaborate with the physician, optometrist, audiologist to develop the individualized treatment plan for each patient. So physiotherapists can assist elderly individual with exercise to improve their balance and coordination, so they can provide guidance and safe mobility techniques and environmental adaptation, so that the one can safely navigate the environment. All right. Regarding the hearing loss, physiotherapists can provide the assistant with balance and coordination exercise, as well as advice on communication strategies and the use of assistive device itself.